So welcome to the last keynote, the last wind-up of what's been a really amazing conference, I think. This is a closing keynote and it's been given by Professor Tony Dreise, who's the Pro-Vice Chancellor of First Nations Engagement at Charles Sturt University. And he joined Charles Sturt in January last year. Having been at the ANU for some time. With major interests in Indigenous education, health equity, and systemic reform through culturally grounded approaches. And he's going to talk to us on First Nations health research, wholes versus wholes. As he's not there, but it's coming. It's coming. Thank you.
Thank you. Yama, hello everyone, and I'm very conscious that I'm competing with a horse race, and I take it that's the reason people are running late. Anyhow, I hope this turns out to be the keynote that stops the nation, but I highly doubt it. So can I acknowledge country, the fact that we're on the lands of the WHRN nation, this beautiful nation, this big, vast nation. When you tour our campuses, you just are reminded how big this nation is, the biggest on the eastern side of Australia. Now, the second biggest is Kamilaroi Nation, which is my mob, and Ualega. Kamilaroi are just to the north of Wiradjuri, and we've kind of had border disputes for probably 65,000 years or thereabouts. But I do acknowledge country. There's this kind of rather awkward title I've given to my title, my presentation, wholes versus wholes. And I suspect you probably know where I'm going with this. But anyhow, let me take you through, hopefully, my logic without there being too many holes in it. Let's start with wholes, and I'm thinking from the perspective of First Nations research, and indeed First Nations education, and the relationship fundamentally between the West and First Nations. And we're up against it in terms of building a relationship with First Nations in the research community that's reciprocal, respectful, robust, and balanced and nuanced around particular contexts. From the outset, research was in terms of colonial Australia, research was an active agent and not necessarily a positive agent in how First Peoples were viewed, often through Darwinian type thinking that there was a deficit. These people needed to be domesticated, civilised, Christianised. One of the first schools created in colonial Australia was in 1814 on the banks of the Parramatta River. It was titled Native Institution, and it was one of the first schools for Aboriginal people, including as young as 3, where the job was to domesticate and civilise First Nations people. Equally, during kind of the large part of the colonial project in Australia, we've had varying truths. And here we are in 2026, still grappling with our national truth. And you see that through the process of the voice and attached initiatives, whether it's a process of national truth-telling in Australia and indeed treaty making. You'll hear Mob talk about us being the most over-researched people in the world, and there's quite ample evidence of that being a problem that we have to overcome, but we have to overcome it because research is too important an initiative for us to kind of give up and say, oh no, you've been over-researched, so we won't do it anymore. No, we've got to change the rules and the relationship. Too much research has been done to and about, as opposed to with and by First Nations people. And you'll see in more recent years, a movement towards self-determination, including in the research community. And don't forget, in a Western sense, Aboriginal participation in higher education is still but a baby. Charles Perkins and others being the first first Aboriginal students in the 1960s. The first PhD, Bill Jonas, 1990, the first Torres Strait PhD, Martin Nakata in about 2000. So it's relatively young. Then we've kind of fallen into traps and holes where research too often is about the researcher, as opposed to the subject matter. And a lot of research can be self-serving, and in a way we've kind of created that beast. For example, the big markers of success are, for example, publications, citations, as opposed to on-the-ground impact and change. And too often we fall into the folly of one size fits all. We've still yet to come to terms with the environment for which positive research can happen in First Nations spaces. For example, time. We still don't give enough time for quality research. Look at us, we race to competitive funding grants. We cobble together as quickly as we can because we've got to seize the opportunity. And yet for research to be healthy and sustainable with First Peoples, you need it to be relational. It's got to be based on relationships, particularly in a field such as health, where it's so personal. There was a beautiful, I can't recall if it was the title of the thesis or a journal article from the First Nations researcher in Canada, and she called her paper "A Year Spent Drinking Tea." And she was highlighting the importance of relationship, and that's where it has to start. Now, our funding agents, are they going to fund us for a year to drink tea? I don't think so. Let's shift to holes. And you'd be familiar with this model and others like it in the First Nation space. Note, it's called Social and Emotional Wellbeing Framework, and I much prefer the title of Wellbeing to Health, because I would argue it's more holistic. And whether we like it or not, health often connotation with the title of health, it equates to hospitals, doctors, nurses, when well-being can be all sorts of things: country, kin, relationship, history, politics. And you can see through ample data where we get these things wrong consistently. And I would argue the hole we fall into is we are ignoring the holistic reality of First Nations wellbeing. History, let's take history. 1788, in the grand scheme of things, wasn't that long ago. Stolen generations, you had as recently as the 80s. Some argue it's still going. When you look at increasing numbers of out-of-home care for First Nations people, it's actually growing. 1 in 5 Indigenous young people, children, will grow up at some point with one parent incarcerated. Think about that. Think about the stress on that child and those households. So we've got to look at these wider determinants. They're crucial, not only in terms of risk factors, but protective factors, such as connection to country. Children, for example, who are strong in identity and including language enjoy better outcomes than those without. That's despite, for example, over a number of decades, Northern Territory education policy saying you will not speak mother tongue at school because that's getting in the way of English. That's absurd. In order for you to learn a second language, you need your first. Or you're trying to build on sand. And it's children that I want to focus this conversation around. Education's been my passion all of my life, including from chairing the Indigenous Literacy Foundation to being a board member of Adult Learning Australia to being on a number of ministerial councils. And we know in public policy, people, including children with better health education outcomes, generally enjoy better health outcomes. There's no doubt about it. You know, there was a figure, and don't quote me on it, every dollar spent on education, you get something like a $2 return in health outcomes. And so once again, adopting a holistic frame, let's have a look at what's called the Australian Early Development Census. This is a survey, well, survey is probably not the right word actually. This is a census, an assessment made of every 5-year-old in Australia every 3 years. So the last one was earlier this year, or last year, and the data was presented earlier this year. They call that cohort of kids the COVID kids, because at the time they were 5, it was during the COVID period, and they were particularly keen to see whether their outcomes were different because of the COVID kids, particularly around social skills. Nothing too definitive come out of it, but anyhow, every 5-year-old in Australia, first year of formal education, they are assessed against these 5 domains. And sadly, but perhaps not surprisingly, our children tend to be underdeveloped across a range of those indicators. Now, this is so important to you and your field of work, because we know outcomes early for children will have an impact later down the track, particularly around development. And health and education and other systems are getting more, I suppose, sophisticated around recognising developmental challenges. They were around us when we were kids, which we weren't aware, there were titles for it. Nowadays, and I'm particularly attuned to this, having one child of my own who's on the autism spectrum. He's high functioning, but I have a new appreciation of, you know, how each of our young people are totally different, even though their environment may be the same. Earlier in my life, I was on the side of nurture. I'm kind of leaning more towards nature, but both are important. So we assess 5-year-olds. So many of our children are developmentally vulnerable. Now, it's a pretty good gauge, AEDC, and one could argue, well, we need it at regular intervals throughout life, because all those things there you see in front of you are important for a 5-year-old, and they're important for an 85-year-old, particularly social connection. But it's comprehensive, but I argue not whole. Let's contrast it with the Australian Early Years Learning Framework. Again, I think important from a health dimension. We, as human beings, again, a 5-year-old or an 85-year-old, we're continually in a process of becoming. I think the minute you aren't, you're dead. We're in a process of becoming, and you can see it in older people and the activities they pursue in older life. For example, men's people want to pursue social connection, communication, and a sense of attachment. One of the biggest threats now to our health outcomes in the world, including Australia, is what? Loneliness. So we yearn for this sense of belonging. Again, whether you're a child or you're an adult. And of course, being is the very thing you're probably most interested in, how people, you know, their sense of well-being, their sense of being. But I would invite you to think about health and health research in that more holistic domain. It teaches us, for example, belonging. No, we don't want to belong to a hospital for too long. We want to get in, we want to get out. But we do want to belong in the community of Orange or the community of Walgett. It will result in better outcomes in life because we know the risk factors that are against belonging are so profound, namely loneliness. Let's come back to the social, I beg your pardon, the emotional and wellbeing framework. And you'll see this in National Aboriginal and Torres Strait Islander health policy. When you think of these things, the historical determinants, political determinants, look at the political determinant most recently, the voice outcome. That was a blow for First Peoples, whether you like the model or not. And there are First Peoples who didn't vote for yes. But when the result came in and it was 60-odd% and only one jurisdiction said yes, and in some jurisdictions it was 80, 90% saying no, that has to have a profound effect on psychology and spirit level. And it did. So when you weigh that up against other determinants, be it social, economic determinants, for example, poverty, and the very clear relationship between poverty and health outcomes. There's so many areas of where our mob are up against, and that's shown very clearly in data. But again, I remind you of the protective factors which are in that inner circle there around connection to spirit, spirituality, ancestry. They are, as I mentioned just a minute ago, give you a sense of belonging. We know that collectively, these determinants together bring us to an environment of complexity. We work in complex systems here. You can't be in health and think it's simple. And yet we fall into traps too often, and I want to explain this through this lens. This framework was developed by a Welsh intellectual. His name's Dave Snowden. He, of whatever reason, probably because he can share, a story of invasion and colonisation, being Welsh, and the English, stealing language and other things. Anyhow, he named his framework, and it's a framework to deal with problem solving. He named it Cynefin, and Cynefin is a Welsh Indigenous word meaning place or habitus. And Dave, he developed this really strong interest in Indigenous education here in Australia. So I met him in Lismore a number of years ago. And this is a guy who was engaged from, by the Pentagon, the White House, the UK Cabinet Office, because he actually invites us to think about problem solving in a different way. So let's go to his framework. We would like to think that in health and other disciplines, more and more we are creating best practice. So we've turned things into simple, which you simply replicate. And there is ample examples of that in health where there is best practice. He argues there's a difference between complicated and complex, and it's not semantics. Complicated is when someone's partly worked something out. We're part way to a cure. We're part way to an answer. And therefore, if we kind of sense and analyse and respond, we can start moving to good practice, not best practice. Best practice is arguably, the holy grail, the silver bullet, however one wants to describe it. In the chaotic space, he says things you just simply have to respond. So, for example, in the case of war, you can't send out a research project. You have to respond, and you analyse later, you assess later to see how your response was. And he calls that space novel. The one that stood out for me is complex. And he calls this emergent practice. And I think this is where so much sits. And it ought to be the area we're most interested in as researchers and as educators. Namely, that we're not quite sure. We can't claim what works. We can claim what is worth trying. So this is your space for innovation, probing, sensing, responding, experimentation, getting a sense towards a phenomenon. And that is the realm he calls emergent practice. I would argue a lot of the space around Indigenous affairs, whether it's health, whether it's education, whether it's Indigenous policy, sits in this field. Complex, and we can't afford to oversimplify it. And to go back to my earlier comments about, the unfortunate taste that research has left in the mouths of a lot of people, we can't afford to give up. Because there's so much more that we have to understand, and we can only do that through probing and sensing and researching and trying to get a greater understanding. I'll flip back for a sec. So how do these complexities manifest themselves? Well, let's go through a few examples, and they're not for easy listening, but they're truth. So many of our people are literally sick through racism. I've already reflected on the relationship between poverty and health outcomes. We're not moving the dial, particularly when you look at certain postcodes. Tony Vincent did some really good research 10 years ago or something, and he called postcodes on the edge. And he looked at postcodes in Australia, and he said disadvantage has a postcode in Australia. And all of the top communities, postcodes in each state and territory were either Indigenous or remote. And that obviously is something you're mindful. If you're working in Western New South Wales, you can't ignore it. You shouldn't ignore it. Outcomes are different in Sydney compared to Cobar or to Walgett, which is incidentally where my grandfather was born. Other manifestations of this complexity, suicide. It's heartbreaking to think that the leading cause of death among 5 to 17-year-olds in First Nations communities is suicide. The leading cause of death. Then let's think of other manifestations. 23% of our people who report a health burden say it's either anxiety, depression, or drug abuse. Again, the importance of holistic thinking, including health in the mind, health in the spirit. Then there's these real practical things, the price of fruit and veggies, food security in remote Australia. Do you know the highest point of which in some remote communities in the Northern Territory, the highest times when people were buying fresh fruit and veggies? When was it? During COVID. Who got that right? Full tick there. It was during COVID. Why? Not just supply chain improvements, no. It's because people had more income. Remember when I think they doubled Social Security? People could afford to buy fruit and veggies. And now we're going back to a situation where, it's absurd what people are paying. Let's think of other manifestations. And I don't wish to kind of make this hard listening, but we've got to listen to it. Here's data. In 2018, it's estimated that 240,000 years were lost amongst First Nations people because of premature death. Think about that. Almost 250,000 years. And I've already touched on, for example, particular vulnerabilities for children with reported that 1 in 5 children at some point in time will have a parent incarcerated. So how do we respond to this, including in the research community? Well, I've touched on this model and invited you to think about this domain of complexity and emergent practice. Another way to think about it is the concept of collective impact. So you see the picture on the left, and we tend to do this. I reckon this looks like research. We launch 1,000 balloons, don't we? And some parts of the system actually incentivise that, including my earlier point around citations and publications and income, etc. We actually set up these things. And researchers, you know, a lot of us researchers like to be, you know, kind of soul travellers, lone wolves, you know, give us a dark room and a computer, we'll be right. So, and we actually put people through the stripes or the ropes that way, don't we, with a PhD, you know. It can be a very lonely journey and activity. So in some ways we make the rod for our own back. Then there are thinkers such as Kenny and Kramer from Stanford University who really have been at the forefront of social innovation. And they talk about collective impact. So, you know, I just stole that off the web, don't tell anyone. But it's like that movie, isn't it? Up. Was it Up? Yeah. I remember watching that with the kids and it just stood out for me, that image. And we need more of that, what they describe as collective impact. This can and should be part of our thinking in health systems. The first thing it does is it calls for a common agenda for change. Even within the health system, even within the health community, again, we can be lone wolves and not connected. And I see with great interest that the key theme of this year's research conference has been collaboration. Well, that's one way of thinking about it, about marshalling around a common agenda for change. And this is particularly so in situ, in place. That we get far more sophisticated around shared measurement and data and results, and in First Nation spaces, actively promoting data sovereignty. If you look at governments for too many years, they held data as a stick, as a punitive. Your community's not doing this, so we're going to do that. Think back to the Howard years with mutual obligations. You reduce petrol sniffing and we'll build a sports hall or something. It really got to be that crass. As opposed to data being empowering, owned, people aware of it, people mining it, people taking charge from it. And then they talk about mutually reinforcing activities, again, marshalling around a common agenda. I particularly like these models in child development spaces because if you think of the old adage from Africa, but equally relevant in Australia, it takes a village to raise a child. Well, who's helping the village? It's through this action that we can kind of attend to the village, mutually reinforcing activities. Again, think about the holistic frames I was presenting earlier. When it comes to connecting to country, for example, that's not the business of a health system alone. Connecting to country has all sorts of manifestations in policy and programs and practices. Open and continuous communication. Well, wouldn't that be nice? As humans, we crave it, but we're not particularly good at it. You take a staff survey of any large organisation anywhere in the world, what do staff complain about most? Well, other than management, which I know, yeah, all those non-pro vice chancellors there, yeah. No, they complain about management and they complain about communication. And then this idea of a backbone coordinating organisation, and you'll see public policy systems starting to adopt this, whether it's through the Empowered Communities Model in Indigenous Affairs, whether it's through Children's Ground in the Northern Territory, the idea of this backbone organisation marshalling all of that and pursuing an agenda of collective impact. I invite you to think about that in terms of, you know, one of the holes with a W in your thinking going forward. I want to end with what we intend to do at the uni, if that pesky management gets out of the way. So we're currently developing First Nations research strategy. We're looking at 3 drivers for this strategy, principles right from the United Nations Declaration of the Rights of Indigenous People through to IATSIS, the Health and Medical Research Council, are the guiding principles which go to empowerment, data sovereignty, self-determination, etc. We have to invest in pipelines at Charles Sturt, and this is a home goal of ours. We only have 1 level D at Charles Sturt First Nations. We have 0 level Cs. We can't sustain that. Now, on the positive side, we've got a lot more E's than we do D's and C's, which is a good thing. And we're pretty good in terms of A's, so we're starting to develop this pipeline potentially. But we've got to actively scaffold around it, and we're not doing that. The bulk of our staff at First Nations at CSU are professional. And a number have an interest in an academic career, including research, so we want to build pathways and pipelines for them. Which means thinking differently about how we grow, for example, a PhD. We don't make it easy, and there will be those who will argue in the academic community, and rightly so, it should be a high bar. I get that. But there are a lot of clever people out there who don't need to get to, you know, teaching in front of the class or participating in a research project that don't necessarily have that journey, particularly if we're more serious about recognising people and their professional prowess, i.e. all those practitioners out there. And nowhere is there a better example than health. So whether it's kind of a professor of practice or a professional PhD pathway, we need to think about those things to grow our research community. And then finally, the idea of place. And I've deliberately called it place for a couple of reasons. One, it picks up the notion of in-country, and you know, in-country, not on-country. Country needs to be a thing that can follow you and is in you. You don't necessarily need to be on it. It needs to be in you. And then, but I've also got in situ. Have a look at Western New South Wales, the demographics, First Nations demographics. It's not all traditional owners. We have tremendous mobility. If you are a First Nations person, you live in Orange and you want to go to OMS, you don't produce a kind of Wiradjuri card. You're a First Nations person who is a resident here. And there are reasons for mobility, some voluntary, some not. Some mobs being moved around forcibly, some voluntarily. Some in relationships, you know, a myriad of, or plethora of marriages that are between nations. Perfect example, Gamilaroi and Wiradjuri. So we've got to think of in situ, we've got to think postcodes, we've got to think of communities that, through a lens that isn't limited to in-country. And that we get connected pieces, whether it's through a collective impact model thinking, whether it's through coalitions of support, whether it's signing up to an agenda, let's, make one up. WHRN, Healthy Mob WHRN 2050, laying down a longer term plan for the well-being of that community. It can be done if policy levers are in the right place and if we as researchers are prepared to be positive disruptors in this space. The great virtue of being an academic. Let's rediscover it, including bravery. There's threats to that. One only has to look at the United States and an agenda of trying to shut down academic thinking and thought. So, very practically, these are the sorts of initiatives we want to pursue over the next 3 years at Charles Sturt in the First Nations space. You note here, this is one of 4 pillars. We have another for people, teaching and engagement. This one's the pillar to do with the research. You notice how we refer to First Nations researchers and First Nations research. Very deliberate. We don't want to close doors to people who are genuinely passionate in this field and can bring expertise to this field. And the reality is we don't have mob in every discipline across the academy. That's the reality. I don't know the Murray or Curry statistician yet, but there's an example. We're starting a project here with Orange School of Dentistry, looking at the relationship between oral health and heart health. Now, the majority of those researchers aren't Indigenous, but we make sure we set up the project to ensure that it's robust, respectful, quality, Indigenous-led research, and you can do that. So these are the things we'll be actively working toward over the next 3 years. Our research strategy, we are looking to finalise by the end of this year with it having a shelf life of 26 to 28. And on that note, I'm going to thank you, particularly given that you chose me over a horse race, albeit reluctantly, as I saw